Today, we find out a lot about our politicians. Today, we find out a lot about the men and women that we entrust to run our country. It's rumoured that about 80 Tory MPs could rebel against Boris Johnson's Plan B. The government is so concerned about it being voted down that it rather sneakily has split it up into 3 different chunks. There's likely to be a vote at some point on the new face mask rules. Another one is likely on whether a daily negative test result should allow those exposed to a positive case to avoid self-isolation. And a third vote is expected on vaccine passports. There are a couple of things I think people should really focus on here. Sajid Javid is already talking about changing the definition of what it means to be fully vaccinated. He's already saying that you may need a booster jab to get a vaccine passport. So let's just break that down. If you want a vaccine passport going forward, you'll have to be triple jabbed. This would then set the precedent that the government can change the definition of what it means to be fully jabbed at any stage. So it means that even people who've had COVID and been double jabbed still couldn't enjoy some of society's most basic freedoms. I don't think that's a good thing, because it won't end there, will it? This vote will formalise an irreversible cycle of pseudo-mandatory vaccines upon which your freedom depends. There will be no going back. This will be our country forever. Do we want that? But there's one thing that is going to slip through without a vote, as far as I can tell anyway, and that's our booster rollout. So there should be far more discussion, in my opinion, a parliamentary debate as well, and probably even really a vote on whether or not we should be focusing so many of our resources on this vaccine rollout. We're about to divert a huge amount of resources away from patients in desperate need simply to help with this vaccine rollout. Now, I think there should be more discussion about this, especially considering, at the time of stating this, the official number of people in hospital with Omicron is 9, apparently, not the 250 that Dominic Raab said on national television earlier today. I'll leave it up to your imagination as to whether or not you think there was anything deliberately disingenuous going on there. If people find themselves having routine operations cancelled, GP appointments cancelled, perhaps even telephone consultations cancelled, then that will obviously affect their lives, their personal well-being, potentially even their mental health. I don't think it's too much to expect some form of vote on whether or not Omicron, as yet considered a relatively mild form of COVID, is worth going to these lengths for. I find it fascinating that our government and the likes of SAGE are not telling us that South Africa's Omicron wave has resulted in fewer severe illnesses. 4% of patients died, compared with a fifth in the other waves of the infection. This is according to the latest data. That's a huge difference. Boris said that we face a tidal wave of Omicron. In reality, I think it's more of a watershed moment for our country, a parting of the sea, if anything. In the coming days, we may become a nation that judges how free their citizens can be by the amount of vaccines they've had, and we could set the precedent that whenever there's a new variant, totally regardless of how dangerous it is, we will focus the majority of our NHS on that, at the expense of people who are ill with other ailments. Britain may never be the same again.